The National Health Department says it is working with the Border Management Authority to intensify health screening services at land ports of entry to mitigate against the cross-border transmission of cholera. The department says it has noted reports about the recent cholera outbreaks in neighbouring countries like Zimbabwe, and it has urged travellers returning from cholera-endemic areas to be vigilant for symptoms and to cooperate with health officials. And symptoms include diarrhea, leg cramps and vomiting. Foster Mohale is with the Department of Health. He speaks for them and joins us now for more on this. Foster, good evening and thank you very much for your time. You talked about the Health Department launching the screening operations. Just give us a sense of the scale of the setup.
Yeah, good evening to you and good evening to your listeners and compliments of the new season. Yes, as the Department of Health has noted the current outbreak of cholera in Zimbabwe and other parts of Africa, especially some parts of Mozambique and Malawi. That's why I want to say to all South Africans that there's no need to panic because the situation is under control. We are working closely with the Border Management Authority, which is the implementing agent through the port health officials who are assisting with the screening of all people who are entering the country, especially through the Bed Bridge, which is the border between South Africa and Zimbabwe. As we know, that majority of people who are entering the country, people are coming from up to Zambia, Malawi, Zimbabwe, they come through the same border gate. So we say we have to intensify our screening services to ensure that everyone who's entering, even those who are coming in a bus, they have to get out of the bus, we screen them, then the bus will pass through, then we'll have to go and enter the bus on the other side to ensure that everybody who enters the country, they get screened of cholera and any other disease.
Well, what are you most worried about?
Yeah, we are worried about, as we know that as the country, we've just came out of outbreak of cholera in the country, especially in the parts of north of Pretoria and around Hammanskraal, where a number of people have lost their lives. So we are trying to prevent the cross-border transmission of this disease. As you remember that the first two cases that we detected in the country were imported cases from Malawi, where two people who traveled to Malawi, then they contracted cholera, but the signs and symptoms, they were only visible after they've arrived back into the country. So here we know that we may not be able to detect all the cases, but we are trying to mitigate any possible transmission, especially where we can be able to see that someone has got the signs and symptoms of cholera, and also those who are coming from cholera-endemic areas. To say, please try to cooperate with port health officials. Try to be as transparent as possible, because we are not only trying to prevent the transmission, but also trying to protect them so that those who display suspected symptoms of cholera, we are able to refer them to the nearest health facility for testing.
Yeah, we shared some of those symptoms, Foster, with regard to, diarrhea and so on. Maybe just to recap again, if you're experiencing the following conditions that you will share with us now, go and take immediate action.
Yes, some of these symptoms, of course, they are not different from symptoms of other health conditions. We talk of watery diarrhea, dehydration, vomiting, the headache, the body pains. We say, please don't waste time. Just go to the nearest health facility, because we may not be able to tell that you are suffering from cholera or any other disease. But the sooner you go to the health facility, is the quicker you're able to prevent the transmission, but also to save your lives. As you know that more than 30 people lost their lives in the country, and also more than 200 people so far have lost their lives in Zimbabwe. So we are trying to to avoid going back to that situation where we lose the lives of our people because of preventable disease like cholera.
All right. Now, I think importantly, Foster, for those who've come into contact with an infected person, what advice for those groups of people?
Hygiene is one of the most effective preventative and control measure that we advise people to maintain. Washing hands with the water and soap, clean water and soap, and also using the sanitizer. And we say everyone who's preparing food or serving food, try to make sure that you clean your dishes, you wash your hands before and after using the bathroom, in order to prevent the possible transmission of cholera, because with our naked eyes, we may not be able to know or see that I'm suffering from cholera. So hence we say if you suspect that might be having some running tummy, don't think that you have eaten some wrong food, but especially if it persists for 2 or 3 days, don't waste time. Just go to the nearest. You lose nothing by going to the nearest health facility for medical observation.
All right, well, thanks for that. Appreciate you stopping by and sharing that information with us. Foster Mohale speaks for the Department of Health. It's very serious if you are displaying those symptoms to take urgent action. It could mean the difference between life and death.